Please start.
Start the timer.
Timer, please.
Okay.
Yeah.
Good morning, respected judges and everyone present here. My topic is comparison of retinal imaging using smartphone and indirect ophthalmoscopy in emergency rooms and wards. Ophthalmoscopy is required to be done in various emergency and non-emergency settings. It's a useful clinical tool in emergency room to rule out certain life-threatening conditions like features of raised ICT in the form of papilledema. Retinal and disc imaging has been important part of assessment of other medical emergencies like trauma, hypertensive emergencies, optic neuritis, hemorrhagic disorders, etc. In non-emergency settings, diabetic retinopathy, hypertensive retinopathy, ocular tuberculosis, and various ocular vascular occlusions are the main indicators of ophthalmoscopy. In addition, it also forms an integral part of examination of children under anesthesia in operation theaters for tumors like retinoblastoma. Various methods of ophthalmoscopy are there. Conventionally, it is done with ophthalmoscopes direct or indirect, which are portable but have limitation of ability of image storage. In addition, requirement of a trained examiner cannot be overlooked. Retinal imaging systems are excellent tool for use in ophthalmology clinics. This study was done to compare the utility of smartphone ophthalmoscopy with conventional indirect ophthalmoscopy in emergency rooms and wards. It is a clinical prospective single mask comparative non-interventional study. The study was done in emergency rooms and acute care of tertiary care hospitals. Total 100 cases were taken and pupils were dilated with tropicamide drops and put twice at a gap of 30 minutes. Indirect ophthalmoscopy was done using this using the smartphone and the N20 diopter lens and indirect ophthalmoscopy. The videos were captured and stored in a data bank, and conventional ophthalmoscopy is also done with 20 diopter lens. Comparing the results, we mainly out of 100 patients, normal findings were recorded in 70% patients. 10% had disc edema, 12% had hypertensive retinopathy, and 8% had retinal hemorrhages of various etiologies like diabetic retinopathy, trauma, platelet disorders, etc. The average time taken for smartphone ophthalmoscopy was larger, that is 126 seconds, in rather than in conventional ophthalmoscopy was 102 seconds. The sensitivity and specificity for smartphone were 80 and 86% respectively when compared with indirect ophthalmoscopy. To conclude, in this study, good correlation was found in both the methods. The images were acquired in reasonable time available in the clinic. The quality of images were realistic for analysis. The results showed good correlation between the two methods, which was clinically and statistically significant. This method seems to have immense potential to be used in community settings, that is easily available, low cost and wide applicability. It is portable and potential of data transfer with mobile network. It is now estimated that almost 50% physicians use smartphone. This device has versatile camera and excellent screen resolution. This method has extended utility of being used by technicians in community settings. The ever expanding mobile network and use of data clouds make this procedure more lucrative with regards to teleophthalmology. Similar approach of retinal imaging can be used by medical personnel in remote locations in certain life-threatening conditions like papilledema or high-altitude cerebral edema. The images can also be sent to ophthalmologists for opinion. And the limitations of this study was in required of patients with clear media, which is comparable with both indirect and smartphone ophthalmoscopy. To conclude, this study has clinically and statistically significant correlation was found between smartphone and conventional ophthalmoscopy in retinal assessment of medical emergencies. Thank you.
Nice presentation.
The
Illumination wise, what difficulty you face?
So, pardon?
Illumination wise.
So illumination wise, initially earlier smartphones were little bit we face difficulty, but nowadays smartphones have evolved so much, like even with a gap of 1 or 2 years, 2 years back, the smartphone illumination or the camera quality was subpar, and now it is far better. Now it's more easier, the quality of images are more better actually nowadays, even with a gap of 1 or 2 years, because we have done earlier also. I've been doing since I've done from 1 or 2 years back with old smartphones and now with the new smartphones. so they have better quality of images.
Tell me one thing. Previously, smartphones didn't have this option. Now you have these smartphones. You keep the illumination on and you go into
Yeah.
the video mode.
Yeah, yes, sir. Exactly
Right?
like that.
So that
sir.
is how you take it.
Only the problem is just the focusing, sir, because initially, which
But is
like
the illumination from the flash of the
Camera, yes, sir.
laptop, the mobile enough
yes, sir, it's
to
quite
penetrate
enough.
through
yes, sir.
everything?
Yes, sir, it's very clear picture. it
Okay.
comes.
In the study, you said about some time
Yeah,
it took
time
for
taken,
scanning
yes, sir,
or
that's true.
whatever.
It
So
takes-
how did you judge that? Because when you're doing an indirect ophthalmoscopy, you're not really timing yourself.
we did time ourselves.
So
while
what was it? In finding a particular
Yeah.
lesion, or how
Yeah.
did you
Uh,
have the start point and the end
the
point?
start from the start of indirect ophthalmoscopy till the diagnosis of the fundus, either it is normal or with any pathology. It's like that.
So why did smartphone take a little more time?
The practice, sir, because even though we are more accustomed to indirect ophthalmoscopy, so that's the factor, sir. Because if we practice more with smartphones, then it will be shorter, sir, definitely.
Yeah, so you should have rephrased it. Don't make it capture time, because capture is capture when you take a photograph, and
Okay.
that you can't do with indirect,
Yes.
right?
Yes.
So the time taken for assessment varies,
Okay.
right? So that is something that in the study you should have emphasized
Achha, yes.
and made positive features about it. But it's a very good study. I think
you.
you continue with it and make it a more useful one.
Okay. Yes, sir. Thank you.